It's a bit like a volcano about to erupt. These atherosclerotic plaques start to then change, a blood clot forms, and that is then what leads to the artery blocking off, and that's what causes the heart attack or the stroke.
Welcome to the Expand podcast, where we unlock the secrets of respiratory health for healthcare professionals. Join leading experts as we dive into chronic lung diseases and expand your practice.
Welcome, everyone. We're going to talk today in this podcast about cardiovascular disease. You're going to have a better idea, okay, what do we mean when we talk about cardiovascular disease, and what are the risk factors, and what is the COVID doing in the changing the life in the last few years and the relationship with cardiovascular disease, and can we have any prevention and or treatment also? And what are the most important ones? We have the chance to have a guest speaker who is going to be in this interview, Dr. Kim Connelly, who is a cardiologist and a scientist, and very well known nationally and worldwide as an expert in human and rodent echocardiography, cardiovascular MRI, and impact also of diabetes. His main interest is really diabetes and cardiovascular disease. Dr. Connelly runs a basic research lab at the Keenan Research Center for Biomedical Science at St. Michael Hospital in Toronto, Ontario, where he focused upon basic mechanism of the disease. He is the director also of the Cranville Stem Cell Facility at St. Michael Hospital, and use stem cell-based therapy to improve cardiac and renal dysfunction as a result of diabetes. This is an area of research that don't necessarily has some application in practice now, but it is coming in the near future. And Dr. Connelly was trained at the University of Melbourne, Australia, where he did both his cardiology training and a PhD. I'd like to welcome Dr. Kim Connelly for this podcast on the COVID-19 and the cardiovascular disease. Kim, this is a real pleasure having you, and then we're going to dig in cardiovascular disease and later on the relation with COVID. What has drew you first, okay, to go as a cardiologist and in training in this sub-specialty?
Yeah, well, thank you, John, for inviting me. It's certainly a pleasure to be here. I got interested in cardiology actually because a friend of mine that I went through university had type 1 diabetes and required insulin. And when I was a university student, he had some health problems. And I got interested then in the impact of diabetes upon the heart. And that then led me to study, more broadly the entire cardiovascular system. So it was actually an experience with my good friend back in Australia with diabetes.
That's kind of interesting. We often have these story of people having a close family member or a friend, okay? And this is kind of unfortunate. At the same time, it is what seems to have driven a lot of us in medicine or choosing a subspecialty. We hear a lot about cardiovascular disease. It's the number one after cancer. A killer in the world, and there are so many of the different type of cardiovascular disease. Can you, for the audience, and the audience is also the large public here, tell us a little bit more when we're talking of cardiovascular disease? What are we talking about here?
Yeah, I think it's really important that we all are on the same page here. So, cardiovascular disease is a very broad term. And usually we think about it as diseases that affect the heart or the artery or the veins of the cardiovascular system. And so then we can move beyond cardiovascular disease, which is the very broad term, and break it down into other areas like coronary artery disease, which is generally conditions that directly affect the heart. And most people know about that as a heart attack.
Hmm.
or you can have what we also describe as a brain attack, which is cerebrovascular diseases. So that is conditions that affect the arteries to the brain. Or we can also have peripheral arterial disease, which is generally the blood vessels in the tummy. You might have heard of an aneurysm, or
Yeah.
there might be a blockage in the artery to the legs, and that's peripheral arterial disease. But there's also a number of other conditions within that. But mostly you'll notice the commonality between those is blockages in the arteries, which then lead to damage to the organ, the heart, the brain, the legs. But we can also have other conditions that can affect the heart. Some folks are born, unfortunately, with genetic conditions that can weaken the heart muscle, and we refer to that as a cardiomyopathy.
Hmm.
That one's, we usually call it dilated cardiomyopathy, but you can also have unusual ones where the heart muscle thickens up. So it's really a very broad term, but as you just mentioned, it really is important because it's the number 2 cause of death, unfortunately, in developed countries, and around the world, it's still probably the number 1 cause of death. So these are very, very important conditions, and that's why there's so much research and so much study being done to understand them, so that we can hopefully prevent folks from developing these cardiovascular diseases.
Talking of prevention, and that would bring us into a better understanding of what are the risk factors, because in the 50, there was this very large study called the Framingham, and we have learned there's been a lot of other cohort study from a population-based since, but we've learned a lot about the risk factor. Can you tell in the public and maybe some patient listening here, what do we know about the risk factor? Because it's been so important in managing not only the disease, but preventing, okay, that some of the cardiovascular disease, the most common one, can happen.
Yeah, I think it's one of the great things about the cardiovascular diseases is that, in fact, the risk factors for whether or not it's the condition affecting your brain, your heart, or your leg, they're actually all very similar. And we could break it down into a number of sort of easy to remember things that are the risk factors. And when we say risk factor, these are the conditions that can lead to the development of the heart disease or brain disease or leg disease. And smoking is a very, very important risk factor that definitely leads to an increased risk of heart attack, stroke, or a leg attack, if you will. So smoking is an important one. High cholesterol is
Hmm.
another one. And frequently with our diets that we have in the Western world, the food that we eat has a lot more cholesterol in it, or your body creates the cholesterol. So that's an important one. High blood pressure around the world is probably the number 1 cause of the cardiovascular diseases. Diabetes is a very, very important cause. And the other one that we often talk about is the family history. There are genetic causes. Now, they're the more obvious ones we talk about, but we also know there are a number of lifestyle factors that can contribute beyond the 5 that I just mentioned. And that includes, your diet, what you actually eat, how many times a week, for instance, do you have fish and fruit and vegetables? A healthy diet reduces the risk of heart disease. Alcohol intake seems to be a risk factor as well. A bit more controversial, but there's no doubt it's thrown in there. And also the level of activity that folks do. Less active people are much more likely to have and develop these cardiovascular diseases. And you mentioned the Framingham study, really important study that helped determine what these risk factors were. But there was another study that was done by my Canadian colleagues down the road. I'm
Yeah.
in Toronto, but they're in McMaster, which was called the Interheart study. And
Okay.
why this was important, and I bring it up, it's because if you looked all around the world, it didn't matter where you were, in a developing nation, in what we call sort of the first world nations, the risk factors were the same. And I think this is important because it tells us if we get
Hmm.
the right treatment and the right advice, then we can reduce the risk of cardiovascular diseases.
That's quite interesting, and thanks for bringing this like the Canadian contribution, because it's all along the discussion. Please, if you can refer to Canadian discovery, because
Yep.
Canadian are are very strong, and we don't unfortunately talk as much as we should about discovery coming from the medical world. And this is prevention of disease, and cardiovascular disease are a very good example of how it had impact on these disease and our understanding of trying to change, for example, high blood pressure. But often we include high blood pressure as part of cardiovascular disease as well,
Yes.
isn't it?
Absolutely, absolutely. So as I said, the big five that we usually focus on: high blood pressure, smoking, diabetes, high cholesterol, and the family history. So absolutely important. And as you know, blood pressure is such a simple and easy thing to measure. You can go into a Shoppers Drug Mart here in Canada and get your blood pressure checked. And back to those Canadian contributions, I'll just remind everyone that we've just had the 100th year of the discovery of insulin, which was also through McLeod and Banting and Best, yet another great Canadian contribution. And in fact, just back to how I got here, that's how I ended up in Canada. I trained in Australia, but because of the discovery of insulin, I was looking for a place to, continue my research. And of course, Canada, because of that discovery, was a logical place to go to. So very, very important. Another contribution to international science from Canada.
Thank you. Let's move now to a topic that had changed our life in the last few years, where we had to deal with this pandemic, COVID-19 pandemic, and we're still going through. We're in an endemic now phase where at this time of the year we are seeing COVID. People may not realize. And we're going to talk later on why it is not as important, although it remains serious as well. But why are we talking of cardiovascular disease with COVID? Because COVID, it's a respiratory viral infection. But during COVID, we discuss a lot about cardiovascular disease happening as a complication of COVID.
Yeah, absolutely. I think, the most important point, if I can get the message out there at the moment, is there is a lot of COVID around at the moment. So I'm going to say it. Please go out there and get your vaccination rates. The positivity rate in Ontario, as we speak, this is December 2023, is 20%. So it is there. So as you mentioned, endemic, but not pandemic. But to directly answer your question, what's the link between COVID and cardiovascular disease? Well, as you mentioned, it's a respiratory virus. So it generally gets in through the nose. But one of the things that COVID does is as it enters the body, it directly impacts the cells which line the arteries and the veins. These are called the endothelial cells, and it causes an inflammatory response. Now, we mostly think about inflammation as when you cut yourself and it gets infected and you have a response to that. However, the same process that occurs there can also directly impact the cardiovascular system, because you can imagine that if you've already got underlying disease, that is, you've got cholesterol starting to affect the arteries, the added stress that COVID brings can then unmask and uncover a scenario which might then lead to a progression of the narrowings in the arteries to the heart, which can lead to a heart attack. It can do the same in the brain or the legs, and it can also affect the veins, and it in fact can cause blood clots to occur in the veins in the legs. So you can see at multiple levels here that a simple virus, which we're not used to thinking about how it can unmask a problem in the cardiovascular system, becomes such a major problem. And obviously the pandemic was huge. It affected millions and millions of individuals there. So although if you think about all your friends, not many of might have had a problem, when we think about a large population, we start to see there's a number of folks, in fact, who have got critical disease, didn't know about it, and then the COVID unmasked it, and now it becomes a big problem. So not only is your body dealing with the infection, it is now dealing with the fact that we've uncovered and stressed the heart or the brain or the legs, to now we're not only dealing with one issue, we've now got two issues. And that's why the COVID pandemic really was so incredibly and profoundly impactful, because we don't typically see that. That being said, we do know that the common flu, influenza, also increases the risk of cardiovascular disease. So there are links there as well.
That's interesting, because people, obviously, there are other respiratory viral infection. The flu and in season is also an important one. This is where the vaccine is also strongly recommended. And all these respiratory viral infection, what they are doing, as you explained, is that they affect the lung, but in fact, at the end, this inflammation that is triggered by the respiratory virus will become systemic. That means that inflammation will not remain in the lung, and as such, that can create other system to be impacted, such as the cardiovascular system, either the brain, either the heart, and like you say, the vein, okay, because there's been a report also of the thromboembolic disease, where people can really complicate it. And some people have not realized that the virus itself is more risky of any of those as compared to the vaccine. We're going to come back to the vaccine later on. We've been talking of the disease that could be caused, okay, by this viral infection, COVID-19. But people that already have cardiovascular disease, what is cardiovascular disease a risk factor for COVID or anything related to COVID? What would you say to people that have cardiovascular disease?
Yeah, so I think this is a really important. So we know with the COVID infection, as you said, it gets into the lungs and then it can trigger this systemic infection. So the question is, does that cause cardiovascular disease? Or if you've already got cardiovascular disease, does it make it worse? And we know from looking at the folks that have the bad complications of COVID, those folks that are likely to end up in the intensive care unit, there's a number of common risk factors that we see for cardiovascular disease that are associated with doing poorly with COVID infection. And generally, we break it down to your age. As you're older than 60 years of age, that is a risk factor for worse complications. And of course, the older you are, the more likely that the pipes, if you will, your arteries are to start to block up, because you're more likely to have other risk factors that we've already talked about. You might have high blood pressure, diabetes, and so on. We also know that the same risk factors can develop and impair kidney function. And we know chronic kidney disease is in fact a risk factor for doing badly. Folks who are carrying excess weight, those folks living with obesity, we know that that is also an important risk factor. And diabetes is as well. So they two come together because they're both stressing the cardiovascular system. And the way in which we think that it unmasks this is, as you mentioned, this inflammation is absolutely key. We think that the inflammation is part of how cholesterol gets into the walls of arteries and actually starts to damage the arteries and leads to the narrowings of the artery, which is what we call atherosclerosis. And then you add that extra inflammation response that we talked about from COVID or maybe even influenza. And that, if you will, is the straw that breaks the camel's back. That's enough then to say, okay, what was sitting there quiet and stable now becomes unstable. It's a bit like a volcano about to erupt. And then what happens is these atherosclerotic plaques start to then change. And what happens is they create a little tear in them, a blood clot forms, and that is then what leads to the artery blocking off. And that's what causes the heart attack or the stroke. So they're both very, very tightly related. But as I mentioned, there's a number of factors as you get older, and obesity and diabetes that is definitely associated with worse outcomes with COVID. And there's other ones as well, like we know folks who, for instance, have had cancer and have had on-cancer chemotherapy or have had radiation therapy. If you're immunocompromised for any other reason, let's say you've had a transplant, a kidney transplant, that the drugs can impair your immune system and you're also going to do a lot worse there. So you can see there's a number of common risk factors, but again, we think it's all this inflammation that actually brings it all together and explains why COVID was just so devastating when it came out to all the elderly folks, those that are in the nursing home, because they also have a lot of underlying coronary artery disease. And this was enough to then trigger this cascade of events, which then lead to really bad lung disease, stressing the cardiovascular system, the blood clots, all the things that we've talked about so far.
That's very important what you've just said, Kim, because we often see from the population and the public that these virus and what we want to prevent the infection, the viral infection. But when we're going to talk later on about vaccination, for example, sometimes it is more important to prevent the complication that we make this insult from the viral infection and or the inflammation not to be as important that we can prevent all the trigger cascade that you just described. And then from someone who would have the heart attack, then that person, if you can prevent that complication, even if the person has the infection, this is something that really mattered, and people end up in hospital and people and can end up to die also. You were co-author of a paper that will be published next year that was under the leadership of Respi Plus, looking at risk factor for complications such as hospitalization and death from COVID-19. And you mentioned about age, you mentioned about obesity, you mentioned about the comorbidity. But where cardiovascular disease, there was a lot of comorbidity like congestive heart failure, coronary artery disease that might lead to angina, heart attack. But there were also high blood pressure, and high blood pressure came as a risk factor. And why do you think it's that? I don't think we have the full explanation, but there's so many people that have high blood pressure out there. Do you think it's related to the high blood pressure, or it's related to the fact that high blood pressure is associated with many other complications, such as cardiovascular disease? What is your opinion on that?
Yeah, look, it's a great question. And I think what we know happens when you have high blood pressure is, remember back at the beginning, we talked about the cells that line the arteries, the endothelial cells. These are critical in the development of blood pressure and the development of cardiovascular diseases. And when you have hypertension, these cells their responses become abnormal. They can become damaged. And we think that's one of the reasons you develop the atherosclerosis, the cholesterol plaque. So you can see then if you've got high blood pressure, the cells that line the arteries are already under stress. We add in then the additive impact of COVID on top of that, and now we've got a double whammy on the cardiovascular system there. So I think that's why around the world, probably the number one driver of cardiovascular diseases is still hypertension, which is why this was such a profound effect there. So I think it's twofold. One, COVID, because it can impact the endothelial cells, can actually then lead to the development of hypertension. But if you've already got hypertension, it's going to make it worse. So now we've got this bidirectionality. It's hard sometimes for clinical trials and studies like, the one we did to tease out these things. But what we clearly saw during the pandemic was all those clustering of the cardiac risk factors and clustering of the same risk factors led to people doing a lot worse. So I think, this is not just coincidence. We do have a good biological basis, a good scientific understanding of why the hypertension, diabetes, kidney disease, people living with obesity, smoking, previous, radiation chemotherapy, they all lead to damage of these cells that line the artery. And then when you have another insult on top of it, like COVID, that's what creates the secondary problem there and was such a problem. So, yeah, I think there's no doubt that it's both cause and effect here. The good news is we actually do have very good treatments for high blood pressure. So, as a
Okay.
bit of a plug for folks out there, don't forget to go out, get a simple check and follow it up, because the pills are very well tolerated. They're cheap. They're very effective. But you can see, we've talked about this a number of times now. Very, very simple, but very, very powerful intervention to try and make you live longer and live better. Hypertension is also a really strong risk factor for the development of stroke. And I think no one wants to have a stroke. So, we do have good treatments to prevent that.
Then, just as to summary for people and public and patient, what we've been talking about here is cardiovascular disease and the risk factor. Many of these risk factors are related to our health habit, and that then on the long term, if we change our health habit, we can prevent cardiovascular disease. Some of these risk factors, obviously, we have to intervene on. That
Yep.
High blood pressure is something that can be treated. Diabetes is something that can be treated also. And then there is other treatment, okay, that we can use when we have the condition, but also with COVID. What would we be doing for patients that have cardiovascular disease? Is there any recommendation that we should make to people that already are known to have high blood pressure, to have diabetes, to have a coronary artery disease? They may have had angina, heart attack, congestive heart failure, or they may have had a stroke also, or been at risk for a stroke. What would we say specific to COVID-19 that we can prevent these complications from happening in these population at risk?
Yeah, so obviously now we're sort of moving beyond, what are the risk factors, to getting into the nitty gritty. What happens if you've got one of these conditions? How can we reduce it? So I think there's a number of factors. First, what we want to try and do is avoid getting COVID in the first instance.
Yeah.
And I'm going to send a very simple plug out: washing your hands. Very, very simple thing. And for those who wear a mask, we do know that that's very helpful. Now, moving beyond that, obviously, the next most impactful thing you can obviously do is get the vaccination. Now, the vaccine's important, but it's really important we make this point clear. The vaccine is not designed to stop folks from getting COVID. You can still get COVID, but if you're vaccinated, what it does is it reduces the severity of the infection so that you're less likely to end up with that heart failure, the heart attack, the brain failure, end up in the intensive care, and you're less likely to die. So that is what the vaccine is designed to do. Now, the other really important point is we now have a wealth of new drugs, these antiviral therapies that you can get access to through your family doc, or when you come to the emergency department if you're worried, drugs like remdesivir and so on. So we actually have now specific therapies that are available for folks who are in that higher risk scenario with all those risk factors that we talked about: the high blood pressures, the diabetes, the high cholesterol, the kidney disease, the pre-existing heart disease. So you can get on a treatment early, again designed to, if you're unfortunate enough to get COVID, we can now treat it, reduce the severity of the COVID, which then reduces the likelihood that you're going to end up in hospital and unwell. And it's pretty amazing, because if you think about it, before the pandemic, we'd never even thought about this. Within 4 years, we not only have a very, very effective vaccination that really is incredibly profound at preventing death, it also reduces all the other complications. And if you're unlucky enough to get COVID, we now have specific drug treatments, and these are widely available across Canada. So they are there. You just got to go to your doc, and there's very, very good criteria as to who to get them. But back to your point, the folks that are most likely to have the bad complications of COVID are the folks that these are widely available to, these new drugs, if you do get COVID. So I just want to get the message out there. I don't want folks sitting at home thinking I have to suffer through this. I've had my vaccine. There are specific drugs that we can actually use which will reduce the severity of the infection. So there's quite a lot we can do to, get through this more readily, because the unfortunate truth is COVID is not going away. It is going to be with us moving forward. We've all learned to live with the influenza and the flu. Unfortunately, now we're going to have to learn to live with COVID. So if you're sick, please get to your doc, and there's lots of things you can do. But again, a big shout out for the vaccine. Very, very effective. I think there's no time in modern medicine have we seen a new disease form and come up with a very, very effective and very safe. We can talk about the
Yeah,
safety
that's
profile of the
important.
vaccine. Therapy that's widely available. Within really 4 years. Really quite remarkable.
No, it is true, because it's quite a safe the vaccine for against COVID. Like, people will expect to have some local
Absolutely
effect, okay, that may last 1-2 days. Occasionally, some general symptoms, but remember, this vaccine is given to millions of people, and if there are a lot of side effects, and they're all recorded now through different systems and platform
correct.
that exist across the world. We never got as much experience on a vaccine in such a relative short period of time, because the different vaccine were administered so often. But I think what you said, it's important about prevention. Don't forget about avoiding contact, protecting yourself, and you mentioned about washing your hand, wearing the mask. When I go flying and so on, very few people wear the mask. Very few people will catch COVID in the hospital these days. Okay, I got COVID twice, and not because I'm working in the hospital. I got COVID the same way then most of the population get COVID, when people get together, traveling in a conference with family. Then this is where you don't protect yourself. Then please think about it. Then the vaccine, as you mentioned, and the vaccine is not about preventing so much the infection, it's about preventing the complication. The same thing that we do with the flu, by the way. We don't prevent the flu with the flu vaccine. And those vaccines for viral respiratory infection, the RSV, respiratory syncytial virus, same thing. They prevent the complication. And the vaccine against COVID is one of the best that we ever had. Even the flu vaccine, in the best year where it is effective, it is not as effective than the COVID vaccine. Then cardiovascular disease, back to the importance here of these disease now. Kim, what would you have to say about people? And I know you're doing research, you're a clinician in your area also. Do you want to tell us a little bit about what you are doing, okay, and even outside COVID, but for cardiovascular disease research or a clinical aspect of it that might be important in you're working at the Keenan Research Sound at the St. Michael Hospital.
Yeah. So, so obviously, COVID important. And again, just, the vaccine, as you mentioned, I think really important point. We've never had so much data to follow it up and assure the safety of the vaccination. I think there was a lot of concern about that early on. We continually acquire data to show just how safe and effective these vaccines are. And just so everyone's on the same page, we're talking about these mRNA vaccines. So you're not getting a virus when they inject that.
Mm-hmm.
What it is, it's a little bit of a protein that is designed to look like the virus. So you're tricking the immune system to say, oh, we've been exposed to the virus, when in fact you have not. So we're not injecting the virus. We're just injecting a little protein there, and then the body recognizes that, and that's how they work so effectively. So so I'm lucky enough. My research program here at Unity Health and St. Michael's Hospital, as I mentioned early on, I got interested in heart disease with diabetes. So a big focus of my laboratory is diabetes and how it impacts the heart. And a lot of folks don't realize that, in fact, diabetes, most folks with diabetes ultimately die because of heart or cardiovascular disease. They have heart attack, they have stroke, they develop heart failure, or they develop kidney disease that then leads to heart attack or stroke. So I've been working on developing new drugs to treat that. We've been lucky that there's been a number of new agents that have come out there that are now widely available. One's called SGLT2 inhibitors, and what they do is they, for folks with diabetes, but they've also fortunately proven to be very effective and safe drugs to protect the kidneys and the heart from heart failure. So we started studying these many years ago, and ultimately it's turned out to be one of the most important drugs we've ever seen in the cardiovascular space. And that's great because that was, again, a bit of a Canadian thing. My colleague at Mount Sinai Hospital here in Toronto was the first person to show that these drugs work. And there's another drug in that space, which is a different one. You might have heard about it, called Ozempic. Well, we also do a lot of research with Ozempic and the similar compounds. And that was also another one of my colleagues who discovered it here in Canada. So yeah, and yet another great Canadian thing. So we spend a lot of time on that. But also what I spend a lot of time is, I mentioned how the vaccines work, not to sound smart, but there are specific proteins in the body that modify how these get in and how the heart responds to disease. So my lab looks at a couple of these, and we're developing new treatments to help the heart recover from an injury. These are called integrins. And then also, because I'm a clinician and I see a lot of patients, I'm always interested in coming up with not only sort of sitting in the lab, but also coming up with new treatments that we can then use to improve the health of our patients. So we run a number of clinical trials, and we have a number where we're trying to, again, prevent damage to the heart after a heart attack using stem cell treatments. And we've also developed some new drugs that improve blood flow to the brain, hopefully trying to prevent dementia. So we've quite a broad program there. And then the last thing I do is I have a big interest in guidelines and making certain that, we do all this work, making certain that we get the message out there so that docs and nurses and the public know what are the best treatments, so they can get on them quickly so that you can get the benefits. Because we do a lot of research, but there's no good in it just being done in the lab. We've got to get the message out there. So I do a lot of work with the Canadian Cardiovascular Society, which is a great group of folks, all like-minded, with the view
guideline and disseminate these new discovery that they can be in clinical practice. And I think we underweight it quite a bit. The healthcare system is overloaded. There is the issue of aging that is brought as something that explained, at least in part, but we often don't mention that a lot of the disease that used to kill people 30 years ago, 20 years ago, now 10 years ago, we have turned these diseases into chronic disease where people live much longer.
Correct.
And they have a better life also. It's not only a question of making people live longer, but it's also that people have a better quality of life. Then it's quite appealing to hear that there is still a lot of discovery and people need to live with this disease and prevent these disease for either progressive, such as modifying the disease progression and or the complication. There is another area also that the stem cell facility at St. Michael. Is this an area where, well, you certainly know, but have you been involved? And this is a completely a different area now. What would you have to say to the public, the patient, and the healthcare professional listening to us?
Yeah, so we've been interested in these, we call them regenerative cells, and what they are is the body has sort of a reservoir, if you will, of cells which are designed to repair. You've all noticed you cut your arm and then what happens? It repairs itself. So it tells us that there's already these cells sitting there. And what we've always taken the approach is that if we can identify the right cell and get it in the right place, we can let the body heal itself there. And what's been very interesting in this journey of understanding these cells is when we look at these cells from healthy folks and we look at these cells from folks who have cardiac risk factors, exactly what we've been talking about, smoking, high blood pressure, diabetes, what those conditions do is they damage these cells so that they don't repair the tissues as well. So our approach has been, and we've run a couple of clinical trials in this area, is we take those cells out of the body, and it's a bit like an intravenous. You put a needle in the arm, and we just simply take your own cells out. And then what we do is we've identified where the defects, where the damage has occurred to those cells, and we try to fix it. Because as I mentioned, those same risk factors actually impair the function of these cells. We've just finished one trial in folks who had very large heart attacks, and we've taken their own cells out of their bodies and delivered them back. We saw some modest improvements with a reduction in the amount of scar tissue in the heart. This trial was called the ENACT-MI trial, a big trial with a number of folks there, my colleagues in Ottawa and so on here. But we do all the work here in that stem cell facility that you mentioned. So there's a lot of work being done as well as in the lung area to see if we can improve lungs. We're actually chatting to the folks at the Toronto Western Hospital about how we can regrow spinal cords and so on after injury. So this is a big area of research. This is highly complex though. So this is not something in 2 years' time you're going to see me getting up there and saying we found the cure. This is going to take many years, but I do believe harnessing the body's own regenerative power seems to me to be a very, very safe and sensible way to try and improve and prevent the complications. The other thing that I wanted to mention too is one of the other areas I'm very interested in is exercise. So we have an exercise lab here, and we talked about the lifestyle modification, but I just want to also give a plug. You know, everyone talks about 10,000 steps. You know, you wear your Fitbit or your watch or so on. But there was a study that came out recently. It was done by American colleagues. It wasn't done by us. That looked at folks who went from walking 3,000 steps a day, which is a pretty small number, only got to 6,000. They almost halved their risk of heart attack or stroke or heart failure. So you don't have to do much to get some pretty big benefits. So we talked about vaccine. I just want to give a plug to say, you know, healthy living, watching the foods. These are all really important things because obviously, you know, we're here talking about COVID and we want to reduce the complications. But if we can reduce the risk factors, then that also reduces the complications. So walking, healthy diet, these things are all extremely important. And you don't have to be at the gym 24/7 to get the benefits. You know, literally an extra 20 minutes walking a day has huge benefits on the cardiovascular system and the whole system. That's your brain as well, because those same risk factors that cause a heart attack are the same risk factors that cause a brain attack. So when you do these treatments, not only are you protecting your heart, you're protecting your brain. And if you're on them for your brain, you're also protecting your heart. So you get two for the price of one.
No, that's important because it's not only about what the doctor can do for you with all these new medicine that we have now or we may have in the future. The stem cells is certainly something appealing, maybe in a decade or more, but it's about what you can do to prevent. And sometimes the answer is something that you can be in control, but it requires obviously a change in your health habit. We don't talk enough about exercise, physical activity, where we're very sedentary, and most of the time now, you take the car, you take the bus, you avoid, because of we have to rediscover kind of the proximity to walk, to do some activity, and so on. And this is very important for many chronic disease and cardiovascular disease in particular. What would you have to if you had to lead people into, is there any place where people can go on a platform and learn more about cardiovascular disease or even some of the research that you are doing?
Yeah, so, you know, I mentioned my work with the Canadian Cardiovascular Society. We call them the CCS for short. There's a lot of work being done to get the message out there. We're spending a lot of time and effort on what we call knowledge translation, which is basically getting the message out. And that's tailor-made for different groups, whether or not you've had the disease yourself, whether or not you're a nurse, whether or not you're a physician. There's different levels of knowledge so that you can work through that and understand it. So that's the Canadian Cardiovascular Society. If you're interested in what I do, if you just come to unityhealth.to, that's our local site here. And I happen to be the director of the Keenan Research Center, which is our large research center here, where we, you know, really focus on a number of these chronic diseases, as you've mentioned, including cardiovascular diseases. But we also do a lot of work in the critical care space. So what happens if you're unfortunate enough to get, for instance, COVID and end up in the CCU, and that we have to do a huge amount of research in that area, clinical trials and everything. So Unity Health is another space. But I would also just tell people, whether or not you want to look more broadly, there is in fact great public pages in Ontario. So if you go to the Ministry of Health in Ontario and put in COVID, it's actually very interesting. What they do each day is look up and tell you what the positivity rate is of some of these infections. And when I've been out there chatting, I was chatting to a cab driver yesterday about this. I think people are shocked to realize just how much COVID is out there as of today, how much of the influenza and the other virus you mentioned, RSV. So you can keep a bit of an eye on that. And I think it's very, very useful. Obviously, we don't want to be alarmist, but I think we also need folks to realize that the pandemic, while we're not in the pandemic with the lockdown, we still have a problem with COVID, and getting vaccinated, looking after your health, doing the regular walking and regular follow-up with your doc is really, really important, particularly if you've got one of these chronic diseases. So if you are unfortunate enough to get sick, we can get the right treatment at the right time. And if you can't have a family doc, well then, there's a number of other clinics and emergency departments where you can go to. Obviously, we want to make certain people get access to their family doc, but there are some issues depending on where you are in Canada as how widely you can access that. But there are lots of treatments and opportunities out there. So, yeah, I love the CCS. If you want to go broader, the American Heart Association is also great. Okay. Yep, and you'll see a lot of Canadian data in there. So a lot of it is driven by research that is being done here in Canada right now, because we really are a global leader in this area.
Yeah, please, to the public and the patient, go to any platform where there is a society that is representative, that people don't necessarily talk under their name, but they talk under an institution, a society that guarantee more that people are going to be careful when they're going to talk. They're not going to say anything they want, okay? And I think what you are recommending, either from North America, including Canada and Ontario, and the Canadian Society, this is really where people should get their information. I would like to thank you very much, Dr. Connelly, for this very interesting discussion. I'm sure people will learn a lot about cardiovascular disease, not only from the part of COVID and cardiovascular disease, although they will. It's still there. It's there to stay. There are precautions that need to be taken. Vaccination is important, but cardiovascular disease is much more in general. And I think that what your advice have been are very, very important. Any patient who has questions can either go on those websites you have recommended. Please speak to your physician and discuss bring those questions and have a discussion with your physician as well. This is very promising. And I think the future is even more promising, but it needs people also to be part of the solution, and not only the healthcare system bring the solution. Thank you very much for your time.
Thank you very much. Appreciate the time. And remember, folks, go out there, get vaccinated, and go for a walk.
Thanks for listening to the Expand podcast. Stay tuned and listen to other episodes on chroniclungdiseases.com/podcast.